Unasikia? Nasaidia watu hapa doc.
The prime time for a lady to conceive. Honestly, I'll give you between 25 and 33. At least by 25 tunajua you've possibly done your higher education, umeanza kupata job, so even financially, psychologically okay.
Yeah.
But even reproductive wise, 25 to 33 you're good to go. And actually if you look at literature, I just don't want to scare people, but if you look at literature, itakwambia ukishafika 30, fertility rate zinaanza kudecline. By the time unafika 35, they are rapidly declining. By the time unafika 38, 40, they've declined already. So I'll say 25 to 33 is a good time to start bringing forth generations. So this is called a tampon.
Okay.
Okay. So of course there are different sizes, different brands. There are sizes for, like this one is normal. Yeah, I think haijaandikwa kama ni normal, but zinakwanga hivyo. Kuna ya light flow, ya normal flow, ya heavy flow, super heavy flow, different brands. But these are tampon. So basically, this is something that is inserted inside the vagina.
Hi guys, welcome to Come Clean podcast. This is episode 4. Episode ya 4. Najua I've not been consistent in terms of releasing the videos, but muniwie radhi, tunalani game ya content creation and podcasting. So as you can see, today niko na a very good guest with me. I know her as Dr.Njeri. We are in Rotary together, and she's a good friend, I can say that. There was a time she came to our club and taught us on matters, what was it? Family planning, yeah. And I saw it's best to invite her because she encouraged men or boys to also take part in these things, to understand. Sikuwe tu tuna atujui, and we have sisters, mothers, friends, so it's important for us to understand this. So welcome doc.
Thank you very much.
Feel at home. I hope unaona uko tense lakini usiogope.
Thank you.
Feel at home.
Thank you for having me.
You're welcome. So maybe you can just introduce yourself kidogo before we actually start the podcast.
All right. Thank you once more for having me. Njeri Chege is my name. I am a lover of women's health. I am passionate about seeing women know their reproductive system, their health, understand their bodies, embrace their sexuality. And so that ties up to what I do. I'm a consultant, obstetrician, and gynecologist based in Naivasha, primarily practicing at Naivasha Level 4 Hospital.
Thank you, Doc. And maybe just to ask, so the way you said you are primarily into women, so is gynecology just about women or it cuts across?
Well, it does cut across because, well, you have to define obstetrics and gynecology because most people don't really understand the difference. So when you talk about obstetrics, it matters pregnancy. So that means your pregnancy from your preconception journey before you become pregnant, your journey through pregnancy, and after delivery. So, and much as it's the woman who's solely responsible for carrying this pregnancy, the man or the partner is equally supposed to be involved in the journey from pre-pregnancy to post-pregnancy. So when it comes to obstetrics, it's about pregnancy, but also the man is involved in terms of the support they have to offer their partner. When you talk about gynecology, it's now any other women reproductive issues that are not related to pregnancy. Okay, so things like your menstrual health, your sexual health, your fertility, your reproductive journey, and the likes. And again, much as we see women mostly, we do encourage the man to also be present in this journey because as much as the scope for men may not be really much in gynecology, we do actually have male clients that we see.
Oh.
So it's primarily women, but the men equally have a role in both obstetrics and gynecology.
Okay,
Yeah.
interesting. And what inspired you to do to study medicine and gynecology, to be specific?
Interesting. So I remember, as a child, how you're told, you keep being asked what do you want to do when you grow older, and I used to have like 5 things I used to say, and for some reason doctor used to be like the first one. Then the rest will keep changing. So at some point I wanted to be a doctor, a lawyer, a pilot, which I still think I'll venture into aviation at some point. I would love the thrill
dreams are
of
still valid.
lifting a whole thing off the ground. So doctor, lawyer, pilot, banker, and at some point actually wanted to be a police woman because I really used to love them in uniform, when you see them standing by the road. So doctor was always consistent. And so I remember one day, I'm a village girl, so I grew up in the village.
Okay.
And so one day we are just watching the news. I was, I think, in class 4, class 5. And then Dr. Betty Gekonyo, the wife to Dr. Dan Gekonyo, was on the news, either a news or some program. And they sort of mentioned something, to my recollection, they mentioned something like she's like the only female doctor, something. I don't know whether it was in a certain field or just general, but I think in a certain field. And I remember telling my mom, I'm going to be the second. Like she's the first, I'm going to be the second. So I didn't even understand in what field she was. And so I grew up knowing I wanted to be in the medical field. And so fast forward to primary school is over, high school is over, you have your grades, and then now you're thinking, okay, so, there were some issues here and there. We didn't primary school, high school, and, I think back then and even now, you need to get a certain grade and certain points for you to actually go to the regular program for medicine, which I didn't attain. And this should be an encouraging factor to those who want to pursue medicine, and you possibly don't get the grade for the regular. There are always ways. So I remember I didn't really think I was going to do medicine, but I knew I wanted to be in the medical field. So I told my mom, you know what, I still want to be in the medical field, but because I'm not going to be a doctor, I'm going to do clinical medicine. So I was going to be a clinical officer. And we applied to so many schools, and much as you're not qualified for the regular program medicine, you are not overqualified for the diploma for the clinical medicine. And so we applied to several places, and eventually one day my mom came with application papers for a passport, and then she came with an admission letter for actually a bachelor's of medicine in surgery, as we call it. And she told me, you've always wanted to be a doctor, you're not going to be a clinical officer, you're going to be a doctor, we're going to move heaven and earth. So this is your admission letter to this particular school, fill up these documents, and that's how the journey started. So I will say I was inspired to be a doctor from a very young age. So I sort of kept the dream and the passion, through and through.
And so you've practiced it for how long now?
If you're to count from the time I did my internship, which was in 2013, this will be my 12th year in medicine.
So experience iko?
Experience. Unaweza sema iko.
Unaweza sema hivyo.
Yes.
And now just to understand, na pia unaweza kunywa chai. Feel comfortable.
Asante.
So just to ask, why is reproductive health really important? And why do you think it's important for us to understand reproductive health? Because I was having a conversation with someone, and akaniambia that especially in this era, we're in the era of information. So people really want to have good information so that they can be able to know and act accordingly. And it's important for us to be able to kupatiana information poa huko nje. It's not really negative or misinformation. So why do you think reproductive health is important?
Well, health generally is important, but when it comes to reproductive health, it's one of those areas that especially women find it challenging to understand, because this is an area where your body is changing, your physiology is changing. From when you're a young girl, now you're starting to get into puberty, things are starting to happen. You're starting to see your periods. You don't even know how they're supposed to be coming. You don't even know what to expect. Majority of the girls are actually embarrassed when they start getting periods. And you need to understand, it's important because they need to understand these are normal changes that do happen in their body. They start getting curious about sexuality, though that one starts at a relatively younger age, but even now as you're getting to puberty, you're starting to be curious about your sexuality. So understanding this is how my body is changing, this is how my sexuality comes into play, this is how my reproductive years are supposed to look like, this is how my perimenopausal years are supposed to look like, and this is how my menopause is supposed to look like. It's really a very big challenge to a lot of women, leave alone men. So the minute you start understanding reproductive health and you get to learn your body and you get to learn the normal changes, the normal, so that you can be able to differentiate the normal and the abnormal. The minute you start learning that, then you're actually more empowered about even your life decisions that you make that will impact your family, your career, your health. So it's important because it's one of those challenging aspects of health that has a lot of changes, and most women don't understand them. So the moment you keep giving more information about it and most women understand, then it improves their quality of life markedly.
Okay.
Yeah.
And about reproductive health, I think it's a foreign concept in African homes, that to even just speak about sexuality and also how just to come clean at African homes, especially at mambo na periods. And why do you feel that is so? And also, I remember when you were when you taught us about what was it, family planning. Yeah, you actually said that you can't really say that this is the best, right? So why do you feel like it's a foreign concept to be able to talk such things maybe in African homes? And how should we move on from there, especially now that tuko hii sasa hii digital era na whatnot? How do you think we can move on from there?
So yeah, it's genuinely a challenge talking about reproductive health in general in African homes. And I think it goes towards, I don't know whether it's shame or embarrassment about, even a mother talking to her daughter about periods. It becomes a challenge. So don't expect a father to be talking to their daughter about the same thing. So I think it has to do with our exposure in the African context, the things we consider shameful, the things we want to sort of hide from the society. But the truth is, these things are happening everywhere. Whether you talk to your girl about it or you don't talk to your girl about it, she's going to get information out there. So we need to get to a point where, as Africa, because the Western world is very open. And you find girls as young as 14, 15, they're very open with their reproductive health, with their sexuality. They visit their gynecologist. They don't need their parents to visit their gynecologist, But here, if a young girl is telling their mom that I need to go see a gynecologist, the first thing the mom thinks is, what have you been doing? What have you been doing? Which it brings about stigma, because now this girl becomes so afraid of even speaking out things that are really bothering her. So I will say it's more of maybe the shame from how we've grown up in Africa and not wanting to discuss some of these things. But the sooner we get out of that bubble, really the better for us.
So it's a challenge.
It is a challenge.
Viewers.
It is a challenge because even when it comes to family planning, for example, even an old, maybe not old, but a mature woman in some places walking into a gynecologist office to look for family planning, they have to sort of get permission from their husbands. You're talking to a woman who is like 23 years and she has like 5 babies, and you're telling her, hey, sasa mpango ni gani hapa, because 23 na watoto watano, you can, and you know, this is not a very empowered woman by 23. So ni mtoto amekatisha life yake mahali. So we're trying to talk to her, so how do we ensure that you at least get your life back? Alafu anakuambia, you know, lazima niende niongee na mzee. Those are the mentalities, those are the things we need to break, because culture has a lot of impact in reproductive health, from puberty to menopause.
And just to also understand, is there like a specific age one should start seeing a gynecologist, you know, and maybe from the men, from the women as well? Is there like a specific age?
So ideally, you remember how you said you're transitioning from being a girl to adolescence and puberty? From around 12 years, you should be encouraging your girls to come and see a gynecologist. Not because they have any problem, but you need to start talking to them about what exactly they should be expecting, because this is when their bodies are literally starting to change, both physically, like what you can see, their breasts are growing, their hips are widening. Some of them may start feeling shy around that time. This is a time where they're starting to get their periods. So it will be good for them to start their gynecological visits earlier. As early as 12 years old is okay. So they just come in. You have a general discussion about basically what they should be expecting and how they should be moving forward. More often than not, we'd encourage. That thing is, most women will not do that. And you see how when you're going to a dentist, there are so many people who do their annual dental checkups without even being sent. Like ajangoja apate shida ya jino ndio aende. So just going because you're very keen about your dental health, so you want to go in before any problem. So ideally, that is equally how a gynecologist visit should be. So you should come in before there is any problem, so that you just check and make sure everything is okay. And then as you start your journey, you have a baseline of, you know, where you're starting. So say 12 years is okay.
12 years.
Nowadays, we are seeing girls going into puberty way earlier. So there are girls who are starting their periods at 8 years, 9 years, 10 years.
Okay.
So if your girl starts her puberty early, basically when she starts, just bring her in so that you also make her understand what is happening.
Yeah, I learn a lot.
Yeah.
And another thing to understand is, especially on, if we focus on the family planning, are there, for the sake of viewers, kuna ile ati safe, like, you know, hii ndio poa, a very good, a safe family planning method, and what are some of the family planning methods you will list
that are available?
that are available, yeah.
So when it comes to family planning, there is no one size that fits all, because what works for me will not work for somebody else. Okay, we can classify them into their effectiveness, according to the effectiveness. We do have methods that are more effective than others. We do have methods that have different side effects. We do have methods that achieve more than just family planning. So there is no one size that fits all, and there is no best, because my best is not her best, and her best is not the other woman's best. So usually when you're discussing about family planning and we encourage a woman to come with a husband or the spouse, we ask you, what is your goal? What is your reproductive goal? What do you want to achieve by having family planning? So if you want to take a break before you start having children, how long is this break? Okay, because we do have short-term methods. If you come and tell me you want to start having a baby in the next 6 months, I'll possibly propose a different method from if you come and tell me you want to start having a baby in the next 10 years. Okay?
Yeah.
So we first ask you, what is your goal? Number one. Number two, then we go to the different types that are there that I'm going to list. We go to, for if your goal is, let's say, the next 3 years, you want to have a space for 3 years. So I need to understand, will you want a method that is hormonal or non-hormonal? Because then there are different side effect profiles for these two different methods. But the first thing is, what is your goal? When it comes to the types of family planning that are there, we do have the common one, I think, that most people know, is the coil. They call it the coil. It's an intrauterine device. So, and this coil can either be hormonal or non-hormonal. And basically it's inserted in the uterus. Okay. And then depending whether it's hormonal or non-hormonal, there are different mechanisms of actions, but eventually they end up preventing the pregnancy. And they equally have different side effect profiles. All right. So when you have the coil, the next one in this category is the implant. There's this method that is put under the literally just beneath the skin. They're long term. So the coil and the implant are long term, because even the short term implant that you have is one that goes for 3 years. There's one that goes for 5 years. The coil, the non-hormonal can go up to 12 years. The hormonal goes up to 8 years. So these are long term. So it depends with your reproductive goal. So the coil, the implant, vasectomy for the men, and the tubal ligation for the women, these are the most effective. Okay? So no method is 100%. That one you always want to emphasize. No method is 100%. But these ones are effective such that they have a failure rate of less than 1%. Okay. So it's not that it can't fail. Juu napatanga watu wanakuambia, hey, mimi mtoto wangu alizaliwa kama ameshika kakoil hivi. You know? It's not that it can't fail, because we tell you none is 100%. Just that the failure rate is lower as compared to the others. So you have the coil, you have the implant, you have the pills. And this is also pretty common. You have the pills that you have to take every other day. Equally effective. The only thing is you really need to have proper routine, discipline. Because you need to take this pill every day, preferably at the same time. The minute you start missing pills, the higher the chances of failure. Then you have the injectable, or what is known as depot to many women. So this is an injection that you get after every 3 months. So even among the questions we ask you is, do you want a method that you have to be taking every so often? Or do you want a method where ukiekwa, you forget about it? Because if you put a coil, other than the routine checkups, you forget about it. You don't have to be doing anything about it actively. If you want a method that you'll be taking every other day, then the pill, but you have to have discipline. And then again, the injection, which is after every 3 months, you have to have the discipline to actually go for the injection after every 3 months. So after the coil, the implant, the pills, the depot, we do have what we call a patch. Okay? And this is a patch that you literally just stick on your skin. And the hormones are absorbed into the system. And they go to work at how to prevent the pregnancy. Okay? We used to have a ring, a vaginal ring, which I don't think it's very common in the market nowadays. And then, of course, as we come down, we have the usual condoms. These are not the barrier methods. The condoms, we have the male and the female. Very effective with typical use. You know, as long as you use it how it's supposed to be, then it's equally effective.
Na female condom inatumikanga kweli?
Honestly, even in my career, nilipewa female condom na colleague juzi. Actually, si colleague, nilipewa female condom na friend juzi. Because not kwa tunaongea na you know, for some reason, even me, who is a gynecologist, mimi sijaipata female condom. Like unajua kuambia msee hivi ndio inafaa kutumika. Like theoretically unaweza muexplainia. Lakini sijaiona. Kama kwa sure, serious, nitakuletea. So I have one in my office, yenye sijaifungua cause no, you know, I think nimeka preserve tu hapo.
Ama nyinyi mshaiona?
Nimeka preserve tu hapo.
Mshaiona?
Honestly, hata mimi, you're not alone. Hata mimi sikuwa nimeiona.
Ushaiona? Iko aje? Sikumbuki. When? Wapi? Wewe mimi sidhani ama ni wapi?
I should credit Lusingari. You know Lusingari from Rotary, because it's Lusingari who actually gave me. I'm like, oh.
And I'm even curious valiwa aje. I don't know. Si ndio?
Well, you have to insert it in the vagina for sure. There's a way you fold it and insert it in the vagina. But no, see, explaining it theoretically inakuwa ngumu kama hauna. But there's a way you fold it and then you just insert it in the vagina. Yes.
Okay, hiyo by the way tunafaa to come tuone.
Sasa sijui kama nitafungua juu niko na tu wako kama
moja. Uko na moja. Si unaweza ongea na yeye alete ingine.
Plug atulete ingine
alafu unaweza ongea na Lucy.
And then after the condoms, the barrier methods, then you have the natural.
Okay.
Which is the calendar days, but you have to have a very regular cycle.
Oh yeah.
Ndio unahesabu unajua hizi ndio safe days zangu. hapa siezi mess. So the calendar they work, but you have to have a very regular cycle.
Kuna app.
There are so many apps in the market sahi. I think kuna my calendar, kuna Flow, kuna period tracker. You know, there are many apps. And you know, I actually tell women, there are women watakuja, alafu she's telling you, doc, my periods are very irregular. So she's actually concerned, and you can actually see the concern on the face. Ni mtu ameshtuka sana. Alafu, you know, when many people come to the gynecologist, they expect to hear the worst. Sijui kwa nini. Anakujanga maintenance, so amekwambia periods iko irregular. Then you tell her, just tell me how your periods come, for example. So anakwambia kama unaona kama August ilikuja hii date. Aya. Alafu September ikakuja hii date. So the thing is the dates are not matching. So wengi wana expect kama period yako inakujanga date 20, itakuwa inakuja date 20. So unapata mtu anakuambia period yangu ilikuja date 20 hii month. Let's assume this woman has a 26-day cycle. So ilikuja date 20 August. So August has 31 days. So if you add 20 plus 26, that gives you 46. If you less 46 from 31, that gives you 15. So kama ili come 20th August, September ita come date 15. Una get?
Okay.
But ime come after 26 days. So September ime come date 15, na tunahesabingi from ile day umepata period, day 1.
Okay.
So September ime come date 15, unaongeza 26. Unapata ni 41. September iko na 30 days. 41 ukitoa 30, unakuja 11. So October ita come date 11. Una get? But ime come after 26 days. So una get, many women will come and tell you their periods are very irregular. August will come date 20, September may come date 15, October may come date 11, maybe November ita come even a sooner date. But now you tell her, umehesabu period inakujanga baada ya siku ngapi? So then you hesabu unapata, it has variation of course, like unapata maybe may come after 26 days, after 25, after 24, imerudi 26. And you just have to reassure her this is a normal period. So many women, your periods may not come on the same. There are those whose periods come on the same day every month, but there are those who will not come on the same day every month, depending na your cycle comes after how many days. So the apps help you track. Juu sasa ukifeed leo August imekuja date 20, alafu September ikuja date 15, alafu October ikuja date 26, November ikuje date fulani, hata inakushow period yako inakujanga after 26 days. So then you know you have a regular. So I always tell women, before kama useme uko na irregular, unaweza track for a while. Unaweza track for like 4 or 5 months. Ukam tuone. Because ukipata ina come consistently after 25 days, that's a regular period. The days will change because definitely months are more than 25. So unaweza pata mtu anakuambia napata periods twice in a month. For example, uko na cycle ya 25. Umeanza period date 1. Ama hata tufanyie November, leo tuko date 4. So umeanza period date 4. Cycle yako ni ya 25 days. So inamaanisha date 29 utapata period. Lakini sasa atakuja seme mimi mwezi nimepata period mara, because they expect period inakuja every month. But unaambia angalia period imekuja baada ya how many days. Then you know if you have a regular period or not. So yes, the periods apps are very
interesting. That's interesting.
Very effective.
And one thing mutaka ku understand, especially on that and fertilization. Yes, especially hapo kwa conception, So if teme a girl anamaliza period, so inakuanga as in terms of pregnancy, inakuanga after how many days? Is it before apate ama after? You mutaka kuelewa hiyo kitu pia.
For you to conceive.
Yes, to conceive.
In relation to your cycle.
Yes, to your cycle.
Menstruation,
yes,
period.
Menstruation, exactly.
So,
mutaka kujua kitu ni after or before?
But I hope you're not asking about getting a specific gender. This is just generally.
No, this is just generally.
So ideally, we like using a 28-day cycle because it's easy to, calculate.
Okay.
So tunasemanga your fertility, by the ovulation, which is when you're releasing the egg, is something that you cannot like accurately time. Unajua ati leo saa hii ndo una release your mayai. And the good thing the important thing to know ni once of your mayai imereleasiwa, once ovulation may happen, that egg stays in our body for only 24 hours.
Oh.
So if I ovulate now, saa hii ni 12:35. Nikiovulate saa hii, hiyo mayai yangu itakaa mpaka kesho 12:35 p.m. After that, kama mbegu haijakaa, it's absorbed back in the, as in it's just reabsorbed somehow.
Okay.
The male sperm can stay in the body for 5 days. Okay? So, kama uko na cycle ya 28 days, because we cannot accurately predict unovulate kesho saa 5, we just know this is your fertility window. And again, the apps will tell you this is your fertility window. For a 20, we usually say between day 9 and day 15 or day 16 of your cycle, hiyo ndio fertility window yako.
Okay. Day 9 and 16.
Then, like that work from day 9 for a week to day 16 is your fertility window. Because sperm itaka for 5 days, though kakamai kakwapo for just 1 day. So we want to increase the chance of, by the time the kamai inakuja, kanapata kuna sperms huko, either zenye zinatafuta ama zenye zimekuwa fresh, you know. But usually from day 9 to day 16. Now this is different depending na cycle. Kuna wenye wako na cycle ya 21 days. Mtu mwenye ako na short cycle ya 21 days, by the time day 11 inafika, window yake imepita. So you have to, ikwangi cast on stone. The 28 day cycle is easier to calculate. But 21 day cycle naambianga mtu mwenye ako na cycle ya 21 day, your fertility window can start as early as day 6 to around day 12. Because it's a short cycle. Mtu mwenye ako na cycle ya 35 days, fertility window yake inaweza kwa sasa hata inaanza maybe day 12 to like day 19. So ina vary depending on the cycle. But on average, day 9 to 16.
Yeah, okay.
Upon the chances are improved.
Okay.
And to mention, there are many women who come and complain about inability to conceive.
Okay. And
if you're less than 35 years, we usually give you a whole year to try. If you're more than 35, we give you 6 months. 35 and above, we give you 6 months to try. Why? Because the probability of a conception in a single month is like 20-25%. As in ile probability utapata mimba na hii cycle is that low. So we want to give you time so that you increase these chances of conceiving. So kuna mtu anakuambianga mimi nilipatana na msee once and I got pregnant. She's lucky. I mean, she's lucky. She was within the 20% for that period. But majority of the people will not conceive with a first encounter. You get married today, you will not conceive with the first month. Like, you know, mtakaa mkae, tunakwambianga take, if you're less than 35, chukua hii mwaka yote. Continue trying, because chance ya kupata mtoi na hiyo month moja, imagine it's as low as 20%. Then of course if you're 35, you want to give you a shorter time, because tunajua ukishafika 35, fertility rates zina downhill. So you also don't want to take so much time with you.
Okay. And also just to touch on that as well. So pia in terms of menopause, kuna kwanga na a certain age that like hauwezi pata mtoi, but sometimes kuna zile rare cases mtu wako I don't know 40 what. Kuna ingine shai kwa abnormal, mtu wa how old amepata? Mtu amepata mtoto. Sarah Bible. Ushaisikia?
We would like to know what is the prime time for a lady to conceive. Yes. Tujipange mentally.
Unasikia? Nasaidia watu hapa doc.
The prime time for a lady to conceive. Honestly, I'll give you between 25 and 33. At least by 25 tunajua you've possibly done your higher education, umeanza kupata job, so even financially, psychologically okay. But even reproductive wise, 25 to 33 you're good to go. And actually if you look at literature, I just don't want to scare people, but if you look at literature, itakwambia ukishafika 30, fertility rate zinaanza ku decline. By the time unafika 35, they are rapidly declining. By the time unafika 38, 40, they've declined already. So I will say 25 to 33 is a good time to start bringing forth generations.
Na kwa hiyo tu bado kuna kuanga na sijui kama ni myth utademystify that the earlier you conceive sijui mtoi pia anakuwa bright, ama hiyo ni jaba hiyo, I mean it's a thing.
Maybe not necessarily, because we know as you age, one, the quality of your eggs inapungua. Okay? The number is predetermined. This is also something most people don't know. So I don't know that to address your menopause question first, or see if I can go with this. But as a woman, when you're inside your mother's womb, you're already producing eggs, as you call them. Okay? By the time you're born, like ukiwa kwa uterus ya your mom, you have like 7 million ovaries. By the time you're born, ziko like 2 million. So they've already rapidly declined. Ndo unazaliwa. So by the time you're born until the time now by the time unafika puberty, they've equally rapidly declined. So by the time unaanza period ya kwanza mpaka period ya mwisho, we estimate that you ovulate around 400 eggs. Okay? So one, menopause is genetically predetermined. Okay? There are women who will go into menopause early. There are women who will go into menopause later. You'll find, for example, if my mom went into menopause late, there's a chance that I may also go into menopause late, but I may also go into menopause way earlier than her. Because other than just the eggs and everything, even our own body size and our lifestyle habits also influence. So tying up with the question, as you're aging, remember the number is already reducing. Number is in my eye, and the quality is equally reducing. So as the quality is reducing, when you say quality is reducing, it means kuna vitu zinatangwa chromosomes. You know chromosomes, yeah? So there is a high chance of getting chromosome errors in the eggs that are being produced. Okay? So if you produce an egg that has a chromosome error and you bring about this child, possibly it means this child is going to have a challenge somewhere. It can be retardation, it can be like the Down syndrome, it can be other congenital abnormalities. So you can say the earlier you get babies, the better, because at least you know you have good quality eggs, because you know definitely as we age, una increase chances there is chromosome abnormalities, of which kuna chromosome abnormality, trust me, itakuwa na shida. Either ni hizo mental retardation, physical congenital abnormalities, and slow development in your neurocognition system. So yeah.
So I hope umesikia.
Actually, let me ask a follow-up on that one. So quality of the eggs in a diminished for ladies pekee ama even in men?
Oh yeah, baby.
Yes.
Oh, as well.
Yes. So there is, you know, we like saying sisi tunaingianga menopause, but you guys can sire a child even when you're 90. Story of Abraham or Bible, Sarah, that is divine intervention. So, and of course we've heard of women who've actually gotten pregnant at 50s anyway, because remember I said it's genetically predetermined. Possibly at 50 years bado alikuwa ajengia menopause bado. But the quality of the sperm has actually equally been shown to decline. And when you're even looking at infertility can either be a woman's issue, a man's issue, or both. And sometimes when you look at the male issue or the male cause of the infertility, it actually goes back to the sperm. As you age, the sperm is also aging or equally increasing in the chromosomal abnormalities. More often than not, you call it fragmentation in the DNA. So sio ladies pekee. So even the sperm in itself and the quality of it also does decline with age. The difference is, sisi, we are producing our eggs every month, and we've already said they are genetically, like you kona number, unafaa ukifika hii, your eggs are done, your ovaries are done working. For you men, you are continuously producing sperm. Ifikangi mahali ati unakatisha sperm. You get? So you're continuously producing sperm. So even at 80, 90, you can still get a child.
Okay.
But yes, the quality can equally be different. If you realize those 80-90-year-olds wako na wasichana wanatoshana aje, the two young girls, the two young girls. So, but yeah, to answer the question, the sperm quality equally declines with age.
Wow. Next,
another question. Now with the new generation, we've heard about freezing of eggs. I'd like to know what freezing of eggs is. Would you advise young ladies to do so? So yes.
All right, good question. It's not something that routinely comes up, but women are nowadays empowered, okay? And women want to achieve their career goals before they start being tied down with babies and families. And with the discussion, we've already identified quality ya mayai goes down as age goes down. So when it comes to freezing of eggs, it's a woman saying, I'm taking charge of my fertility. I'm taking charge of the quality of babies I may want to produce. I'm taking charge of my life in general because I want to achieve this before I get babies. So it is something that we advocate for. If you see that you're not ready and you don't want to start using your 40-year-old egg, it may still be okay, a 40-year-old egg, when you have this one, that if you have the capability, you can freeze. So basically, egg freezing is a process of harvesting the eggs from your body. It can be a bit invasive because you may have to stimulate you, or even if you're not stimulating, we have to track, from the time you get your period, because yes, ile time unaanza period ndio mwili na recruit mayai, so that the main one that will develop the survival for the fittest. So you recruit many eggs. Majority of the time, mingi zitapotelea tu kwa system. There is one that will survive the demands of ovulation and eventually ovulate. So sometimes we actually have to stimulate you so that you produce many eggs that will actually go all the way, and then sasa to harvest hizi mayai, and then we freeze them. So it is something that women should not be ashamed of. It is something that women should actually embrace. It is taking charge of your health.
Okay.
Yes.
Okay.
Speaking about the cost, right? Is it expensive? Is it something a normal mwananchi Kenya anaweza fanya? Yes. And are there facilities here in Kenya
that are doing so?
Yeah.
Well, the process of egg harvesting in itself, I will say affordability is very relative. And even a normal Kenya mwananchi is very hard to define. But you find the process, more often than not, the process of stimulation can cost you around, and these are rough figures, the audience, please forgive me if I'm not very right. You can actually correct us in the comments. But I think you'll find the process of the entire harvesting journey may be around 40, 50, 60,000 bob. And then now when you freeze, because you have to pay for them every year, annually, for the longest, for the time until you're ready to use them. And I think the charge for that may equally be around the same figure. So you may have to be paying like 50 Gs maybe per year to keep them frozen until the time you're ready. We have several fertility centers in Kenya, especially Nairobi. So I'm not advertising any, but they are there and they do offer these services. Yeah, they're available.
Okay.
What we don't encourage, caveat, is young girls who want to donate their eggs for money. So if you want to harvest and freeze for your own use later on in life, once you've achieved what you want to achieve, that's fine. But we don't encourage young girls to actually go through the process of stimulation for funds, because they actually, it equally has its own side effects. So for money, we discourage. For your own life choices,
it's fine.
That's okay.
Okay. And another question that was posted to me to ask you was, I have two. One was, why is it that there are some girls or women who experience more painful periods than others, and what causes that?
Okay. So this goes back to understanding, your reproductive system and what happens. So when you start basically when you start getting periods, or rather in the process of getting periods, and I think for the women who have no issues whatsoever, ukishaanza, as I said, the minute you start your period today, as you're recruiting the eggs, there is hormonal interplay, okay? So you're preparing, the ovaries are preparing themselves for ovulation, the uterus is preparing itself for implantation, okay? So then what it means is the uterus lining ya ndani ya uterus ina grow, iki-prepare for, should you conceive this month, we are ready to handle this baby. So then if you don't conceive, the lining is shed. That is what you call a period.
Okay.
Now, majority of the time, when you start shedding your period, it stops by itself. Sindio? If you have no problem, if you don't have prolonged periods. On average, unapata most women have their periods around between 3 to 6 days. So inapungua tu yenyewe, okay? The process of kupungua is the uterus just contracts around itself. So once the shedding imeisha, it contracts around itself, and then there are some two blood vessels that are non-nyongwad. You strangle the blood vessels for the bleeding to stop. In that process of contraction, there are some chemicals, if I may call them so, that facilitate the process of contraction. We call them prostaglandins, okay? So prostaglandin ndio zinakuja, zinasaidia contraction na uterus, then the whole story ya period inaisha. Now that contraction of the uterus, the prostaglandin release does cause pain, okay? So you may find women who have like a lot of prostaglandins being released. And these are women who have painful periods, and majority of the time you can't even identify the cause. So when you start talking about painful periods, you can have we call it dysmenorrhea. So it can either be primary, meaning it has no identifiable cause. It can be secondary, meaning we can identify the cause. Now when it comes to primary, it's mostly about this prostaglandin. Hizi chemicals inatolewa kucontractisha uterus. So you're overproducing the prostaglandins, hence why when you're having pain. When it comes to secondary, we can identify the cause. There is this condition that is not being talked about so much, called endometriosis. Endometriosis is like the major right now cause of painful periods. You can have women who have fibroids that can cause pain, and the causes of painful periods are many. So what I usually tell you, I had a girl who told me, when I'm preparing to receive my periods, like I prepare as if I'm going to a battle. That is not normal. We do have the kawaida pain. As I said, you have prostaglandins that are released for this contraction. And the women who are actually pain-free completely, it does not mean how produce prostaglandins. Lakini sasa kuna yenye wana produce more kuliko wengine. Okay? So unapata msichana ikifika tu ni time ya period, she's already starting to get stressed, she's already getting depressed, she's already, because she's preparing, she's dreading periods zikam juu uchungu. And we tell you that is not normal. Kitambo ulikuwa unaambiwa ni kawaida. You have to vumilia, that is how being a woman is. But nowadays we say pain during your period should not impact you from your daily activities. It's not pain that should stop you from going to school. It's not pain that should stop you from going to work. It's not pain that should make you sick. Like you can't do anything, you're just sick. So pain that should be there ni very mild pain that you can actually just go about your daily activity. Ni ile tu nasikia oya niko na kakram kidogo. Lakini ikifika ni mahali huwezi fanya anything, you can't eat, you can't sleep, you can't go to work, you can't go to school, you're sick, you're vomiting, you're diarrheaing, you're having headaches, that is not kawaida pain. Yes.
Okay.
Yes.
Yeah, okay. The other question was someone asked what is pap smear test and how long should it be carried? Yeah.
All right.
Hiyo pia mimi nataka kujua ni nini.
Okay. So pap smear is a cervical cancer screening modality. Okay. So what happens when you're doing cervical cancer screening, you're basically looking at the cells around the cervix, okay, to see if there are any changes around the cells that could actually eventually become cancerous. Okay, so literally you're screening. So when you're doing a pap smear, and most women fear coming in for a pap smear because they really think it's painful. It's not. It's slightly uncomfortable. It's pretty much, it's very fast. Especially if you get someone who is engaging with the process, by the time anakwambia umemaliza, like, oh, you're done, you know. From the time you know we start doing it, of course utafika, we prepare you, we position you nini, but from the time I put in what you call a speculum to me collecting the sample, 5 minutes hazitaisha.
Okay.
It's literally uncomfortable. So women msiogope, it's not painful. But basically, when you're doing a pap smear, you're looking at the cells of the cervix. You take the sample, it's sent to the lab. The pathologist will look through and tell us if your cervical cells are normal, because you know we are made up of cells. Kila organ ya mwili iko na cells zake. So it will look at those cells and tell us if these cells are normal. Ama, if they're not normal, what you can see is there's some changes here on those cells that if you do not address them, they can eventually become cancer. So majority of the time, pap smear will not even tell you have cancer, which is again why women feel fear to come, because they feel like atafanywa pap smear, akuje tukamwambia kuna cancer. So it's good to know that pap smear is screening, inaangalia cells zako za cervix kama ziko na mabadiliko.
Okay.
And you know what? If you find iko na mabadiliko and you intervene, you stop the process of cancer. So cervical cancer is one of the preventable cancers, and that is why we advocate for screening. Because if you come and you find, yes, umefanya pap smear, imekwambia tuko na changes kwa cervix, tukwambie hizi changes iko hivi, we need to do ABCD, and you do the ABCD, literally you've put a stopgap measure from cancer. If you do not, then as time goes, it becomes cancer, which is what you're trying to prevent. So pap smear is a screening modality. The current guidelines for HIV negative women is to do it after every 3 years. For HIV positive women, every 2 years, preferably annually, but every 2 years. But for HIV negative, every 3 years.
Every 3 years. Wow, okay. Tukimalizia, how important is how important is it for couples to walk into or to undergo this journey of reproductive health? And normally wewe clients wako wanakuwa couples ama ni women solo ama ni men, na hata wanaume wanakujanga? I'm curious to know, by the way.
Okay. Before I answer that, can I go back to the cervical cancer thing?
Oh, no problem, sure.
So, as I said, cervical cancer is preventable. And among the ways we prevent cervical cancer depends with the different age groups. So the government has actually taken an initiative to vaccinate young girls between 10 to 14 years, give them the HPV vaccine for free in government facilities. Then beyond that age, women can take their own responsibility, one, to get vaccinated. And if you're above the age of 21 and you're sexually active, then you start doing your cervical cancer screening. Because 98% of cervical cancer is caused by a virus called HPV. Okay, which is sexually acquired. Men tend to be carriers. Then women, well, we receive it and it stays in the cervix. And usually, virus ni kama flu. You know, you get a flu and you fight it. I don't know why people take antibiotics for flu, because it's viral, na itaisha tu. But now, and that is what HPV does. Majority of the time, the minute you start getting sexually active, utapata hiyo exposure ya HPV. Lakini majority of the time, the body will fight it. So in the rare cases where the HPV stays in the cervix, so it has not been fought, it will stay there, it's symptomless, so hautafeel ni kama uko na kitu kwa mwili, and it can stay there for even 10 to 15 years. Kama imechill tu, haikufanyi anything. And now this is the importance of screening. Because among the screening modalities, other than pap smear, we have a HPV DNA test that you can do. So ukifanya HPV na upate uko na HPV, the virus itself, then we need to follow you up accordingly. So the reason why the government has given 10 to 14 years is because you want to vaccinate these girls, and ideally even boys, before they get sexually active, so that by the time when they get exposed, they've already built immunity. So it's an urge or a call for young girls. Parents, take your girls to be vaccinated for free for HPV in the public facilities. Women between the ages of 15 to 49, you may not get it for free, lakini iko in the private sector, and it is advisable that you get vaccinated. Haitakuzuia 100%, but it definitely will give you immunity. Now, to answer your question about couples.
Yeah.
If you come to my office, I actually have two seats, and that's to accommodate the woman and the spouse and the partner. Because as I said initially as I was starting, reproductive health is one of those, you can say, complex aspects of health for a woman to understand because of all these changes. So when the man comes in and you're explaining, the man gets to understand the woman and what is happening in her body, and he actually gets to understand how well do I also support my partner when she's going through these various stages. It is always advised for a woman to come in with her partner, because the conversation then becomes involving to both. Huyu anatoka kielewa shida yake iko wapi, the other one anatoka kielewa how do I help my woman through this problem. And even as couples, as you're discussing your issues hata kwa nyumba, you should, the male partner should create a conducive environment for this lady to open up and discuss. Because kama tunaongea juu ya do, if you can sit down and have a financial conversation about our future financially, why can't we have a discussion about my reproductive health financially? And reproductive health is not affecting me, it's affecting the both of us. So it is advised, we will encourage men to start showing up for their women, even in the clinics. Let them come, let them understand, let them know how to support their partners. If it's about family planning method, let them understand he method to kieka, these are the side effects we anticipate. So this is how to best support, because there are some that will come with mood changes. So kama elewi, atakuwa like meuma, you're problematic. But if akikam na elewe, then they know I need to support her this way. There are women who, when they're on their period, they're a totally different person. When he understands that, he knows for these 5 days, this is how I play it. Yes.
Kuna swali? Sawa, wewe uliza doc, alafu niko na kitu nataka. Hii sikuwa nimepanga doc nini, but uliza tu.
Okay, so niko na swali doc. Is there a specific number for women that they should give birth normally?
Like number of children?
Yes.
Oh.
Is that minimum or maximum? Kama ni 12, ni target 12, there's no effect?
Well, normally, we don't have a number. I can't tell you at the cutoff ni 1 on the minimum and 10 on the maximum. We definitely don't have a cutoff because your reproductive choices are yours, all right? The thing is, by the time you're giving birth to these many children, even you yourself, how empowered are you to take care of these babies? Because you're going to have 10 children, and if you're not empowered, you're getting to the cycle of poverty. Cycle of poverty, teen pregnancies, poor decisions. But when you look at the physical health aspect of it, pregnancy is a very high demanding metabolic state. So one, if you're not replenishing your body very well, because I'm sure if you're having 10 to 12 kids, you're almost conceiving every year, like almost every year. So your body is not even getting time to replenish itself from what was depleted during the pregnancy. So then you tend to weaken your body. And then there's something called the pelvic floor. The pelvic floor is basically the muscles around your genital area. The more you give birth, because as you're giving birth, you're stretching. So sometimes you tend to weaken the pelvic floor muscles. And the consequence of it is you get what we call prolapse. So prolapse means the internal organs start coming out, because all these organs imeshikiliwa na hizo muscles. Your uterus is held by something, your bladder is held by something, your rectum is held by something. So the minute the muscles ina weaken, unaanza kupata hata uterus inaanza kutokea chini, bladder inaanza kutokea chini. So there is no maximum number, but we do know there are consequences of frequent. If I preempt the same question to a cesarean section, there's no gynecologist is going to tell you don't give birth after this number of cesarean sections. I have personally operated on a woman who was having her 7th cesarean section. But then again, as we say, these are uterus you're cutting. Baby number 1 umekata uterus, baby number 2 umekata uterus, baby number 3 the same. So the uterus is equally weakening. The minute you cut, the integrity is compromised. So You may not tell you not to go beyond 3-4, but then we know you become a high risk every other time because this uterus is not as strong as it was. So uko high risk. Yeah.
At that same question, I saw kwa media watu wakizozana between giving birth normally and through cesarean. Wakisema normally there's is it a bacteria that the kid is usually exposed to, and unlike the cesarean. So I'd like to know what bacteria is that? Is there a difference between mtoto mwenye amezaliwa normal na CS ama wote wako tu the same?
The bacteria they will be talking about is tetanus. And routinely, in most of the antenatal visits, antenatal meaning the visits you come to when you're pregnant, we give you tetanus vaccine. Usually not to protect you per se. Of course, you'll be protected, but ideally it's to protect the baby. There are some facilities that may not give tetanus because tetanus ideally, it used to be given because of the environment at delivery, which may not be very clean, may not be very sterile. Then you can acquire the tetanus vaccine as the baby is coming out. Which, if the environment is not clean vaginally, it possibly means the environment is not as clean or as sterile via the C-section. Of course, C-section you observe sterility. Even vaginal delivery, you observe sterility. Lakini pia ina depend unaenda kudeliver wapi. Kuna places nye si very clean, so then the chances become higher. There are some facilities even within Kenya, and even some gynecologists actually don't routinely give the tetanus because they are very confident mali tunaenda kudeliver, it's clean. But routinely, I give my patients tetanus in your visits, regardless of where we're going to deliver, because tetanus it's a life-threatening bacterial infection. I mean, you don't want to risk that baby getting the tetanus, yet you could have prevented it. So hakuna ati difference between, of course, the vagina is not as clean, and the C-section you prepare it, but I will say get the shot. Get the shot, reduce the risk.
Hey, kumbe leo kuna wanafunzi wengi. Oh, sawa, uliza. Na time yako ikoaje?
Nichukulie simu ambie na kama. Ni hosi.
So Salingweni, would you advise men to go in with their ladies when they're giving birth? Because tunaonanga kwa video.
Hiyo mimi siwezi.
Wanaume waki.
Ai dog, mimi naogopa bana.
Kwa nini huwezi?
Ai dog, kuangalia tu.
But you should enjoy seeing life being
real?
brought.
I don't know. I think is it affect nini yako?
Does it have an effect to the men mentally?
I think this might be a bit individualized because there are men who've gone in and they adore the process and they will go in baby number 1 through whatever number of babies. There is a man who told me aliingia and that is something he can never, ever go back for. You know, the process of, regardless actually, whether it's normal delivery or CS, especially the CS, because you're seeing someone being cut and all the blood and everything, but even normal delivery, I think, traumatizes them more. So it's a bit individualized. I wouldn't generalize because there are men who actually do enjoy. There are men who can never do that. Ideally, the woman should receive support even at that, because it's a vulnerable state.
Yeah, true.
So if the support is there,
Why
the better.
not?
Just that now you may find different hospitals, different policies.
Okay.
But yeah, I will say the woman should receive support.
Simu.
Ingine.
So, Doc, you umeelewa Stacy. Me, I think I'll be very scared, but anyway, subject to kujichallenge.
Pata wa kwanza. Ama uko naye?
Bado. Ama sijui, but bado sidhani.
Pata wa kwanza
so,
uingie uone.
hii sikuwa nimekuprepare, and it's something I want you to actually teach me. Okay. So with me I have I have this. So you know ile project yetu ya nini? So I have this. And hii hapa. So nataka you walk me through in terms of how to go about it. Because by this sijawahi buy pads.
Mbona?
I don't know, for some weird reason, I don't know why. Na niko na sisters, I've never, and you know, nataka sasa from now on ni yeah, ni move on from there. To I can comfortably walk in a supermarket and buy. Yeah, shika nini. Yeah, so I really want to understand how it's worn and what's this.
How it's worn.
Yes.
So I think because you're not going to demonstrate these, I can start with these. So these, this is called a tampon.
Okay.
Okay. So of course there are different sizes, different brands. There are sizes for, like this one is normal. Yeah, I think haijaandikwa kama ni normal, but zinakwanga hivyo. Kuna ya light flow, ya normal flow, ya heavy flow, super heavy flow, different brands. But these are tampon. So basically, this is something that is inserted inside the vagina.
Okay.
Had you told me about this, I could have come with a vaginal model, maybe. But it's inserted. Are we allowed to open?
Hey.
Oh. It's inserted inside the vagina. So, tampon inakaanga hivi. It has this thread.
Okay.
So this white part, it's an absorbent material. Okay? So then, when you're on your period, you literally just, there are those that come with an applicator. This one doesn't have an applicator. So basically, you position yourself. You can either be lying down, you can either be squatting, you can be standing. Majority of the time, kama umesimama, you can, especially in a bathroom setup, you can be standing and you've placed your leg, maybe on the toilet bowl or somewhere, or you can be standing legs apart. And you basically just push it in the vagina, you know, as high as possible, juu ya ina applicator. But this thread should remain outside the vagina. So it's only the white part that should be in. Okay? So then what happens, as I say, this is an absorbent material. So then it will absorb the blood, absorb the blood, absorb the blood. All right? When it's full, mara mingi hata unasikianga ka pressure. Like, you know, imeja, you can, either you'll feel it leaking because then it's full. Or sometimes you can actually just feel there's a pressure because now it's expanded. And so when you are going to remove, basically, it's the thread that you get and you. So kama ulikuwa umeweka hivi, so assuming this is not the vagina, so we had put it like that, the thread is outside, it's hanging out. So then that will mean once it's full, so it's expanded to maybe that size. So then you just get the thread and you remove it. And then I'll get the next one and insert it.
And how often does it become full? Like daily or at the end of
daily?
Or daily?
No, I mean, it depends on your flow.
Oh, okay.
More often than not, you'll find yourself changing the tampon within like 3-4 hours. You're having to change.
Nini kwa daily?
Huwezi eka hii kitu kae nayo. Hata wewe mwenyewe utasikia, you know, even you yourself you'll feel you're uncomfortable, you'll feel dirty, you'll feel, even if your flow is not heavy, you'll just feel you need to change. Okay? So more often than, unless your flow is extremely heavy, 4 hours is usually the average time where you have to change your tampon, insert another one.
Okay.
So these are tampon, different types, different brands. All right.
Super. Sawa.
Then, and when you're on the tampon, most women usually, especially we have a coil, they're afraid to use the tampon. Juu feeling kama hii tampon itaenda displace your coil. But remember, coil iko kwa uterus, tampon iko kwa vagina. So you can use the tampon even when you have your coil in place. Now the pad, so this is a sanitary pad or sanitary towel, depending. And again, equally different sizes for different types of your flow. Light flow to super heavy flow. All right? And usually, we say if you want to monitor the volume of your period, which is very hard, a normal kawaida pad usually holds around 5 mils of your period when it's fully soaked. Then there are these pads in itangwa maxi pads, you know, those heavy ones. Those ones usually hold around 10 mils of you when it's fully soaked, 10 mils. So to define heavy periods, if you want to quantify, tunasemanga ufai kuona lose more than 80 mils. Okay? So mtu anaweza niuliza nitajuaje 80 mils. So kwa unatumia kawaida pad, ikiwa fully soaked ni 5. So if you're having to use, what is 80 by 5? 16?
Watu wa maths.
80 by 5 is 16.
Watu wa maths.
80 by 5 is 16.
So, 16. Acha tuende
16
nayo.
of these for your entire cycle, that's heavy. And if you're having to use the maxi and they're fully soaked, those are 8 because one is 10 mils.
Okay.
That is how you can, on average, quantify.
Okay.
So this is a sanitary pad. Again, as I said, different flows. Na mara mingi na kujanga na hii pepe yenye nimetoa. So these are sticky, the sticky side. And on this side, inakwanga na wings. So there's still like a paper here kakushikilia wings.
Okay.
So when you take your panty, so this is the crotch area. This is a crotch area. This is the area where you want to protect, because then as you're getting your period up and it a flow. So ideally these, you see these, where the wings are starting, should tie in with where the crotch is starting.
Okay.
So more often than not, depending again on the length, kuna zenye ni super long also. But kama hii, I don't know how to, he will place it maybe somewhere there.
That's
so
the
that
sticky part huko.
this is the sticky part.
Okay,
So the sticky part goes to the crotch area and it extends all the way to behind the panty. Something of the sort, yeah? And then you remove the wings. You remove this paper that is protecting the wings. Right? So then you get the wings should go around the crotch area. So the first one goes to that side. The second one goes to that side. So once you've put your pad, again, stickiness also varies depending on the brand.
Okay.
But ideally, this is how it should look like.
It should look, okay.
So the crotch part is actually protected, but also slightly protects the upper part and equally extends towards the rear part of it. But yeah, that is how a pad is worn.
Wow.
And again, changing also depends on your flow. But again, on average, just like the tampon, within 4 hours, most women will be changing.
Okay. Okay. Super. Hiyo nimelearn. So, nafaa nijue sasa, si ndio?
Yeah.
Thank
So
you.
ukiangalia inakaanga hivyo. So you can see the two wings on the underside. And they are not sticky. So si ati itakustick huko. So this part is not sticky.
Okay.
The sticky part is
ni zenye imeshika sasa there. Okay. Sawa.
Yep.
Thank you for that. I think it's important. Melan.
na una learn flow yake. So unajua kama ni msewa heavy flow unamnunulia heavy flow, kama ni light.
By the way, is a thing hiyo mas
ama unambaia zote tu ndio the heaviest iko na option.
Cravings.
Very important.
Noted. Sawa doc, nimeshukuru sana. Do you have any last words for people? Juu unajua pia majority of people who watch this podcast pia ni ma Gen Z, millennials, you know. Any last words for them in matters reproductive health and why it's important and how they should go about it?
Last words will be, take charge of your reproductive health. Planning your reproductive journey is such an empowering thing, because we are beyond the generation where, you know, society had pressure, ukifika sijui miaka ngapi, you need to get married, you need to start having babies. If you have your plans and you embrace your reproductive health and you understand your body, it gives you the ability to even define your sexuality, define how you want to carry yourself out. So my parting shot will be, choose yourself, choose your reproductive journey, embrace it, and be proud of your reproductive health.
Sawa. Umesikia? Be proud and embrace it. So guys, I really want to thank you for taking this podcast to 167 subscribers. We really thank you all for wale mafans ambao wana watch, and I really want you to tell a friend, share this episode ikitoka, na uambie watu wa watch, wa follow Come Clean Podcast on all platforms. Tuko TikTok, tuko X, Instagram Come Clean Pod 254, and YouTube Come Clean Pod. And you need to come clean. Vile Doc come clean, eh? You need to come clean. So asanteni. Bye.